In the United States, it is reported about 800,000 people each year suffer a stroke, and approximately two-thirds of these individuals survive and require rehabilitation. Dr. Daniel Carney, Medical Director of St. Anthony's Rehabilitation Hospital, joins us to talk about that rehabilitation. Dr. Carney, welcome to Inside South Florida.
Jason, thanks for the time. This is a very important subject. And, we're starting to see more and more people, not just in their 60s and 70s and higher, but I've had patients even in their 30s and 40s who have sustained stroke.
Oh, wow. Well, I lost my grandmother to a stroke, so it's a very important topic for me as well. And I'm sure a lot of viewers at home. Dr. Carney, let's start at the basics. What is a stroke?
Stroke is an interruption of flow to the brain, and it can happen in a number of different ways. It can happen actually three ways. It can happen as a result of the most common cause is blockage from say plaque in the neck that breaks off. Cholesterol breaks off and goes up to the brain, and depending upon where it affects, where it goes, we start seeing different things that can be attributed to that area of the brain. It can also come as a result of a bleed, where high blood pressure gets to be to the point where there is a blowout, for lack of a better term. And like you, I had a mother who passed just from that reason. And her blood pressure was under control, but she had a spike one day. Anyway, there's also from atrial fibrillation that is either undiagnosed or untreated, which is coming from the heart, where there should be that normal lub dub that we've all heard about. And instead, the top of the heart, the atrium, it fibrillates, it just shakes, and the blood's not moving, so it allows for the opportunity for blood to clot. And if that heads north, that can also cause a stroke.
There's a myriad of different reasons for why someone may suffer from a stroke. So let's talk about recovering from a stroke, and say you are a victim of a stroke or you have experienced a stroke. What is involved in stroke rehabilitation? And well, no, hold on. Let's talk about what can happen to you after having a stroke. What's
Great question. Great question. And recognizing that is most important. We have that short time frame that somebody needs to realize that they are having a stroke, or somebody with them is having a stroke. There may be some slurred speech. There could be facial droop. There can be weakness on one side. That has to be recognized. That patient needs to get to the hospital right away. It could be because of any of those three reasons we talked about, all of which need to be addressed right away.
Right away, yes.
And if it's because of a bleed, the blood pressure needs to be brought back down. And more importantly, and since I've been a physician, they're now able to go up and get that plaque. They retrieve the blockage. And many times that restores flow to the point where I've had patients who had an entire side wiped out, and then after they have that procedure, you would never know that they had the stroke.
I mean, the advances in medicine are incredible. Stroke rehabilitation, what's involved in that, and how long does it take for someone to be rehabilitated? I'm sure it's a case by case, and everyone's different.
It really is. The thing about stroke is it's not textbook, and but we have a multidisciplinary approach at Catholic Health Services. Myself, my colleagues, Dr. Manish Patel at St. Catherine's East, Dr. Lena Hurtado, and Dr. Miriam Felice at St. Catherine's West out in Hialeah. We all have that approach, but that seems to be a global approach to stroke rehabilitation. And that's first to make sure that the patient is medically stable. Once that patient is medically stable, then we start to work on the patient's opportunity to regain their functional independence. How far back somebody comes is anybody's guess, at least initially on. But what we do as the physician, I want to keep that patient as medically stable as they were the day before, if not better. The physicians, rather the therapists, the physical occupational therapists, the speech therapists, and it's very, as I said, multidisciplinary. We will have neuropsychologists on working with the patient. But we try to get that patient as functional as the body will allow. How much will the body will allow is a deal that is made between the patient and the boss upstairs.
Well, very quickly, Doc, who participates in this stroke rehabilitation team? Like, it takes a village to get somebody to come back from that. And I've seen that. I've been a part of that village for my grandmother, and she didn't, of course, and unfortunately we lost her. But who participates in that team?
As you said, it's a multidisciplinary approach, and with the patient in the middle, we have the spokes to the wheel. We have the physician, we have the physical therapist, we have the occupational therapist, we have the speech and language pathologist, social workers, psychologists, recreational specialists that get the patients engaged in returning to life. Everybody's involved, and everybody stays on that case until such a point as the patient is ready to move on to another setting. Hopefully, that setting is home.
Absolutely. One last question before we let you go. Life choices when it comes to this, preventing a stroke, being proactive. What do you recommend? What do you suggest?
Probably the biggest question of the day, and that is stroke prevention. And there are some things we can control, and some things we can't. We can't control our age. We can't control if we're a male or a female. And most importantly, we can't control our medical history, our family history. Some of the things we can control: if you smoke, stop.
Mm-hmm.
If you drink, only in modification. If you are diabetic, make sure that stays under control. High blood pressure is the number one cause of stroke, and so we need to make sure that also stays under control. And those are probably the biggest issues.
Yeah, the biggest issues. Dr. Daniel Carney, Medical Director of St. Anthony's Rehabilitation Hospital right here in South Florida. Thank you so much for your information this morning. And thank you so much for educating the masses on Inside South Florida.
Jason, thanks for the opportunity.